Okay, looks like we are live. Well,
Yeah.
welcome everyone to Tea Talks with Total Health. My name is Peter Sciavolino, and I am Director of Medical Writing and Scientific Content at Total Health. And today I'm filling in for my friend and colleague Sharon Gill, who is actually traveling back from our Evolution conference in Boston this past weekend. I don't know if any of you had the chance to go to an Evolution conference or been to one previously, but it's an excellent conference, highly recommend. So just a little plug there. But anyway, I'm really excited today to be speaking with my guest today, who is Miss Tenneisa Jackson. And Tenneisa is a freelance medical writer like myself, who is joining us today from the beautiful country of Jamaica. So welcome, Tenneisa.
Thank you, Peter. It's nice being here.
Now, I want to kind of give everybody just a little bit of background. Tenneisa, you and I connected on LinkedIn a little while back. It was after, I think, one of Sharon's tea talks. But then last week, the two of us were in the comments feed, and we were kind of having a little conversation back and forth. And Sharon was like, "Oh yeah, I saw the two of you guys going at it in the comments box."
Yeah.
So we have we had a little conversation going, but anyway, I thought it would be of interest to our listeners to kind of explain a little. I was telling Sharon, oh, it's just us medical writers showing off a little bit, I was telling Sharon, I think it would be of interest. I thought it would be of interest to our listeners to kind of explain a little bit about what medical writing and medical education is. I don't know if you're like me, but it's always fun kind of trying to explain to people what you do. So I don't know if you've had that experience as well, but let me just kind of define what we mean when we're talking about medical education. Obviously, we're not talking about like educating clinicians in the practice of medicine. That's a job for medical school. But what we're talking about with medical education, and specifically on the topic of oncology, is informing not only physicians, but advanced practitioners, nurses, the whole healthcare team, as well as more recently bringing the patients into the equation as well about the just vast amount of new developments in oncology, which if you know anything about the oncology space, it's a big field. There's so much information going on right now. And getting that information out to the healthcare team is a big job. So, one way we do it is like we have these massive meetings like the American Society for Clinical Oncology or European Society for Medical Oncology. And so one of the ways that we do that is through conferences, but a lot of people don't have time to attend these massive meetings. So we have like review conferences like what we do at Total Health. We have the ASCO and ESMO review conferences. But another way to do it, which kind of relates to what we do, Tenneisa, is through writing manuscripts, writing review articles, writing slide kits, and all kinds of different medical media that is designed to bring information from the pharma companies through the medical education companies through to the healthcare team. So so that's kind of a little bit about what medical education is. And so I thought maybe we could talk a little bit about how did you get involved in medical education? Because I know you had actually worked as an MD in the Jamaica healthcare system. So tell us a little bit about that.
Yeah. Well, yeah, great question, Peter. I just want to say it's really hard explaining to people what I actually do. There's a lot of confusion there. And because it's such a wide field, it's hard to just say, okay, well, no, I don't do that part. I do this part only.
It doesn't get any easier. I've been doing this
it really
for
doesn't.
25 years. It doesn't get easier, but continue.
Yeah, so I actually have experience as a medical practitioner, a physician, but over time I realized that my priorities and career aspirations changed. And so I transitioned my professional practice into medical writing, specifically medical education for healthcare providers. Recently, though, I had some great coaching experience, and that allowed me to connect more with why I'm doing this as, a medical writer. And that's how I realized that advocacy definitely has to be a part of what I'm doing. So
Yeah.
I've added that as well on my umbrella. In addition to educating physicians about clinical knowledge, I also want to educate them about health equity.
Okay.
Mhm.
So, I know for me, it's like I got started in this business because I was originally in biomedical research, but a while into my postdoc, and I did a whole PhD, and I did a postdoctoral fellowship, and kind of midway in there, I realized I really didn't fit into the academic research. It was not something that I wanted to do. I didn't want to spend 12-hour days, in the lab, even though I love doing experiments. And I also didn't see my future in the industry. So I got involved in this through a friend of mine that was doing her graduate work at the time, and I've never looked back. One of the things I really like about it, which I'm sure you can appreciate as well, is it's something that you can do remotely, which gives you obviously a lot of freedom. I know for me, like at the time, my son was just a toddler, and I really didn't want to not be able to see him grow up. So it was really of value to me to be able to work from home. So that's one thing which I'm sure you can appreciate that as well. And now, it kind of gives you the ability to work kind of globally as well.
It does. It does. That's one of the things that attracted me to this field. But one thing that didn't change is actually my dedication to improving patient outcomes. So when I found out about medical writing, I was like, yes, this is it.
Right. And obviously you love writing too, like I do. So, and I love science. And my mother always told me too, you should do something with science and writing. So go figure, right?
Go figure.
Now, so I know for me, we like to think of, especially when we're thinking about like, how can medical and education influence something that's kind of near and dear to our hearts, like disparities in cancer treatment and cancer outcomes. So, I know for me, like being able to, my wife was diagnosed last year with breast cancer. And for me to have that knowledge, to be able to go into those appointments with her, to be, have that education, to be knowledgeable and to be there for her so that she can better advocate for herself and understand her treatment. I mean, that was kind of really important for me. I felt like, I'm a Christian, so I felt like, God had put everything in place for me to kind of be there and have that education. But, what I thought about is, how would this play out for someone for a young mother in the community, who's a young single mother who maybe doesn't even have insurance, and it kind of gave me the thought of, how can I use what I do as a medical writer to kind of bring that education to that patient who's in there getting a devastating diagnosis. So I wonder if you said you had some experience in, being a medical doctor, of, what really motivated you to get into using medical education to educate the patients.
Yeah. So as a physician, right, I had many patients that came in with a cancer diagnosis. And one thing they have in common was they were all diagnosed late, right? Even last year, two of my relatives, they passed away from cancer, one being lung cancer and cervical cancer. And the thing is, cancer is the second most common cause of death in Jamaica, and up to 50% of patients present when it's stage 3 or stage 4.
Yep.
Right. So it's usually very late for them. And that leads to this assumption among Jamaicans that cancer is a death sentence. Once you have it, there's just nothing you can do about it.
Right. Right.
So, with those experiences, I decided there must be something else I could do, right? I questioned myself a lot when I lost my patients in medical practice. What else could I do? What else can I do? And when I found medical education, I was like, this is what I could do. But then with advocacy now, patient advocating for patients, it's even adding more to that purpose. And I feel more fuel to just go forward and say, let's just educate people about this so they can present earlier, find out about these things earlier, and get better treatment.
Yeah, yeah. I see we have a message from Sharon Gill who says, hello, Peter and Tenneisa. But I did want to show a question from Sarah, too. She said, Tenneisa, what do you think are the greatest opportunities for medical writers in oncology when it comes to highlighting disparities? And we're going to talk about disparities in a minute. But as a Jamaican, do you see a link between what we can learn from the Caribbean population that applies to us in the U.S. minority populations?
Mm-hmm. That's a very good question. Thanks, Sarah. Well, first question about what we can do as medical writers in oncology. Well, I think starting with at the beginning of the content development pipeline, which is like with needs assessments, right? So I think we were talking about it backstage or just at the beginning of this meeting, right? It's more than just filling the clinical knowledge gap, right? If we focus on writing more about these health disparities inside our needs assessment, then the content that's being taught these physicians will have an impact eventually. I know it's a huge problem, but eventually there must be a change.
Yes, no, I completely agree. And one of the things we do want to focus on, and certainly something that we do a lot with at Total Health, is we have these big problems of disparities. One, we know that Black populations are at higher risk for death from many cancers, including breast cancer. We also know that a big problem is that minorities have been, just vastly underrepresented in the vast majority of clinical trials for new cancer therapies, which is a big, big problem. And the third big problem that I see, as far as educating the community, is just there is a lot of distrust in the medical community. I know that's the case in the United States because of, historical injustices, which didn't happen that long ago. We're talking like a generation ago. We're talking like grandfathers have had a bad experience with the medical community, medical research. So, I wonder how. I know that's a problem in the United States, but how much of a problem is it in Jamaica?
Well, I would say the distrust in the healthcare system, it's a huge problem here. And there are several factors leading up to that, right? One is how well our patients are educated about their diagnoses or the different forms of treatment. Secondly, we are predominantly herbalistic. So we believe a lot in bush medicine. A lot of it, they work. I'm a follower as well. When my grandma gives me some teas to drink, I drink it, no question. Because
there's probably a lot of truth to that as well. I was kind of blown away with some of the cultural thinking about cancer in Jamaica that Sharon was telling me about. Even to the point which, I know she said that herbal medicine, alternative medicine it's huge in Jamaica, and it's a big part of the culture. And it's also there's a lot of stigma about cancer, I understand, to the point where like she was even reluctant to tell some of her family about her cancer diagnosis because it's like a taboo. It's a bad word. What are your thoughts on that?
Yeah, I think it's very much still a taboo here. Cancer diagnosis here is a big secret. Everyone they're open to talking about your diabetic states or whether or not they have high blood pressure. But as soon as cancer comes into the picture, it's a big secret. I experienced it with my family as well, even up to now, having lost our sister about a year ago. They're still like, was it really cancer though? They don't even want
to. Your family doesn't even want to admit. Was it your sister that passed away from cancer?
Yeah, my sister-in-law of over 10 years.
So the family is not even acknowledging that happened.
Yeah, it was a huge secret because I was living away at the time. So when I found out, I was like, how did I not know this? What's going on? Yeah, and then
it's even more of a tragedy because it almost is like there could be a genetic component that, needs to be tested for. So if families are not even acknowledging the fact that a first degree relative may have had cancer, I mean, what is that going to do what are the prospects for genetic testing? And some of these groundbreaking therapies depend upon this very much.
Exactly.
So I want to take a question from Sharon Gill here. It says, how receptive is your advocacy work in Jamaica? How are people responding to, what you do?
All right. So, well, patient education here is not as rampant as in the United States, right? Or other countries like Canada and the UK, but there are huge pockets of resistance still, mainly because of the beliefs in other forms of medicine, right? You have huge pockets of resistance as to what's causing it or how to treat it and what to do to prevent it or to detect these things early. There are advocacy groups doing work on national television and on radio. However, when you talk to people, get down to the ground about it. I just had a conversation with my grandma, and she was like, yeah, but they don't really know, do they? Wow. So yeah. So and then, as I said, bush medicine, they prefer to drink the soursop leaf tea. That's one of the things that's big for cancer now out here as prevention.
Really? What is that again? What is?
So soursop. So it's a fruit, right? Sharon will know. So the leaf, the leaf, it's well known among Jamaicans to have anti-cancer properties. So
this is prepared at home. This is not prepared like by a company or something. This is.
Oh no, it's prepared at home. Yeah, it's a home remedy. It's a home remedy, and that's why we have so many people presenting late. Right? Because they stay at home and they try all these remedies. And then when it gets worse, they present. And so that's how we have 50% of the population with stage 3 or 4.
Wow. I'm going to bring a question in here too from Kristen. She's like, have you been able to incorporate Jamaican indigenous medicines into your educational practices? So that's interesting. It's like, would you be interested in, touting some of these
I mean, it's not something we try to eliminate. It's something we try to integrate with interventional medicine because there's a lot of evidence-based reports out there stating that these things actually do some of what, they're known for. So what we're trying to do is actually bridge the gap between that, getting them to use it as complementary intervention as opposed to the sole, thing that they're using.
Yeah, and I think that could be a way, I think that could be a big call for integrative medicine approaches.
Mm-hmm. Yeah.
But, getting back to kind of the problem of, that so many people are diagnosed so late, I wanted to ask you a little bit, I probably know the answer to this, but, what is the overall uptake for screening? I'm just thinking like for a Black man in Jamaica, something like prostate cancer screening or colonoscopy, which, I just had mine, but, that was still a little bit resistant to it. But what is the overall uptake for something like preventive screening in Jamaica?
Yeah, the uptake for prostate cancer, it's really low. It's low. And that's because our culture is predominantly homophobic, right? So they're not going to want, they're not going to want that type of thing being done to them. They prefer the blood test. And as you know, it's not that sensitive in detecting cancers.
Right. Yeah. PSA is not tremendously, but, certainly probably the uptake is very bad for colonoscopy as well. But
yeah. And it's also bad for like cervical cancer and uterine cancers as well, which is up there with our top causes of death, because women they don't want all that invasive procedure being done, right? That's one. And then a lot of them think, oh, I'm not ready for that yet. That's not going to happen to me yet. So I'm not ready.
Yeah.
Yeah.
I'm going to just take a couple more comments here. Oh, Sharon says, yep, soursop is a huge hit among the Jamaicans here too. I spoke to my medical oncologist about this plant and they advise not to rely on it.
Mm-hmm. Yeah, that's what we try to encourage. We try to encourage not to rely on these herbal medicines. Maybe there's some evidence out there that it does work, maybe, right? But it's usually, just not heavy evidence. It's usually very light evidence, light ties to it. So just please just incorporate it. We're not trying to cut it out completely, but present to your doctors. Go to your
Well, yeah,
doctors.
another thought I had is that, people are maybe they're taking this after they have already been diagnosed, which the benefit may not be as great if you already have cancer.
Mm-hmm.
And I want to just Sarah Loudon, this is why Jamaicans will never stop using that method. But I want to take Sarah's comment. That when a neighbor's son had cancer at a very young age and doctors had a poor prognosis, their nanny started brewing soursop tea.
Wow.
And he's just graduating college. So
yes.
Well, I do think it's who knows? I mean, there may be a lot to this, and maybe it does need to be developed. But these are the kind of things that big drug companies are not going to be interested in promoting, because it is at the end of the day, it's an herbal remedy. So,
it's much cheaper. So
yes, of course. What about, I wanted to ask you too about what do you feel the overall access to some of the treatments that we have for cancer in the United States are? I mean, obviously there's a lot more wealth and a lot more industry investment in the US population, but what is that like in the Jamaican health system? What level of access does the healthcare system have to some of these groundbreaking therapies?
Yeah, great question. Well, our health it's majority public funded, right? And that's a kind of healthcare access a lot of Jamaicans have at their fingertips. But we also have private funded healthcare. However, when you look at the amount of medications that's government funded, none of it is targeted therapy. None of it is immunotherapy. So we have the conventional chemotherapy medications. So if we want our patients to get, new therapies like chemotherapies and immunotherapies, that's going to have to be through the private funded arm, and that's very expensive. A lot of our Jamaicans don't have insurance. So I think 20% of our population has insurance, and so there's no coverage for that.
Yeah, well, when we think about chemotherapy here, that's kind of what doctors don't want to use. I mean, they would prefer to use some of these newer targeted therapies that are a lot less toxic. But what about even something like for breast cancer? What about endocrine therapy? What's the availability of that? I mean,
well, I actually just checked the list of publicly available medications, and I didn't see Herceptin on it any at all, actually.
Even Herceptin?
Yeah.
I mean, Herceptin is like that's the old.
It's the thing, right?
That's
I didn't see it. I didn't see it on it, so. Yeah, wow. That's what I'm talking about. We don't have access to a cutting edge therapy that the United States have access to, and that's why I'm doing what I'm doing. Because if I can get it into mainstream, or help to get it into mainstream in America, then maybe it will, trickle down to Jamaica, because we don't even have clinical trials here. We don't even have clinical trial centers, so we just have to wait until everything gets trickled down to us, so it can be funded by the government.
Wow. So even like there's no like major academic cancer centers at Jamaica,
there is one government funded academic center here and a few private ones. But, as I said, only 20% of the population has medical insurance, so they're not going to get that covered. I mean, they're doing a lot of work to get these equities down. I mean, you're talking about people like Dr. Dingle Spence. She's the head of the Hope Institute. That's our government-funded cancer institution, and she's doing a lot of work to, address these disparities in care.
I want to just take a question from Raquel here, which speaks to what you're saying. How do social determinants of health, such as poverty and education, impact health outcomes in Jamaica? Ooh, I think you might have muted.
Yeah,
Okay.
sorry. Yeah, it has a huge negative impact on health outcomes. So when you talk about education, or clinicians, they have a hard time trying to explain what's happening to patients because one, or language barriers. There's so much and so many ways we can say one thing in English that won't translate into patois for them to understand, right? Because yeah, a lot of our Jamaicans, the vernacular here is patois. So they're not going to understand a lot of things that we try to break down with them. And then that leads to a lot more distrust because then there's also this unconscious bias among physicians that, okay, they're not going to understand. So let me not even try to explain anything. And so, yeah, the doctor patient relationship is largely paternalistic, where the doctor is just leading everything and just leading care, and the patient is just not involved. Then, when we talk about things like poverty, as I said, a lot of people, they can't access these cutting edge medications, right? But our health system is largely government funded. So they do have access to healthcare. And we do have a lot of GPs here. So we don't have to make an appointment and wait weeks to get an appointment with them. So we do have access to GPs, but the medications and cutting edge therapy, it's marginal.
Yeah, and what percentage of the people speak patois?
I would say 100%. I would say
Really?
100%, but predominantly being what they speak, I'm not really sure. I speak patois, but I
Mhm.
also speak standard English. So I'm able to understand a lot of things. But
But you're saying in the medical system, most people don't speak,
in
so
the
they're not
medical
able to.
system, the doctors and nurses, they speak both, but a lot of our rural patients, they don't speak English, standard English, or understand real standard English, or the medical language, because the medical language can't really be broken down, distilled way down to patois most of the times. And so that's where the barrier comes in.
Mm, wow.
Mhm.
So, yeah, well, that's that's such a big problem, But how do you are there like kind of community advocates, patient advocates that can um, be there for patients who may be having problems with, especially trying to understand something like cancer? It's such a huge, the language is so complicated, and
Yeah.
yeah. What are the
Ye-
prospects for, kind of community outreach and, getting people to help with these language barriers?
Yeah, I mean, so one of the common things I see being done is like the relative or the patient will have a relative coming in with them to see the doctor so they can understand and then translate the language to them. But then we have nurses. The nurses do a really good job in educating the patients, counseling them and teaching them about what's going on. Because, as I can imagine as well in the US, doctors here really don't have time to
Yeah.
be, doing the teaching. And so when the nurses now come into the picture, they do get a little bit more understanding of what's happening.
That's a good point. Yeah, that's kind of what I was going to ask you too. I was like, do you think the whole thinking about cancer, the wanting to get educated about cancer, do you think that's changing a little bit with the with the younger population? I mean, people like you. I mean, the internet is out there, all this information is out there, and do you think the trends would be changing away to maybe saying, okay, yes, we have all this alternative medicine, but we need to get you checked out. We need to get you screened earlier. What do you think the
Mhm.
prospects are for that improving in the Jamaican system?
Yeah, I think it has great potential to improve with the advent of the internet and now everything being accessible on the internet. We're seeing some changes, especially with the woman and the uptake with breast cancer screening, as well as doing the self examination. We had a lot of campaigns surrounding that, and so a lot more women are doing their self breast self examination, and so we have a lot of people detecting that, oh, I have a lump, so I have to go get that checked out. Yeah, so there are also programs coming on the local television, because then we have to think about where these people are getting their information from. And so here
Right.
is the local television, it's the radio stations, and then we have the internet among the younger populations. So we do have a few resources, a few campaigns going on local television as well. But I think that's where I come in. I want to partner with a lot of these organizations to improve and increase that, so we can have a greater reach among the population.
Mm-hmm. Yeah. So that kind of also speaks to you mentioned the medical society is very paternalistic. What is the I mean, even for like female physicians such as yourself, I mean, is it still a very male dominant kind of a system in Jamaica?
I wouldn't say so. I think the gap is closing. I think the gap is closing. Several years ago, yeah, it was. But when I was in medical school, it was mostly females. So I think the gap is closing, or will close in a couple of years.
Well, and that's interesting what you say about the nurses being a little bit more advocating more for the women getting breast exams or mammography. It kind of speaks to the success that we experienced a while back in the United States. I mean, there was a lot of advocacy and screening programs, and now we're seeing the benefits of that. So it's good to see that that may be trickling down to Jamaican system as well, where you're getting, it's all about the education, the power of education. And of course I'd like to see that in the prostate cancer space as well, because prostate cancer is to men what breast cancer is to women. So hopefully the times are changing. I want to take another comment from Sarah. Sarah says, this is very enlightening to hear the way other countries access and consume healthcare. I've spent a lot of time on this topic, and my hope is that things change and widen. Great work. Keep fighting. Well, I think on that, we will bring our tea talk to a close. But Tenneisa, I want to thank you so much for joining us today, and it's very inspiring to see you doing this work in Jamaica, and I wish you all the best with your work in the advocacy space as well. And we usually like to leave our, the show is called Tea Talks, so we do like to inspire our T cells, our cancer fighting cells, good feelings. So I don't know if you wanted to leave us with anything, but for me, I'm kind of encouraged by the power of education, just doing what we do and getting the message out there, one about inequities, one about clinical trial participation, and trying to foster that a little bit more positive physician-patient relationship that's going to help to hopefully overcome some of these disparities. But I don't know if you want to leave us with any last uplifting words for our viewers.
Yeah, sure. I just want to say to physicians out there in Jamaica, globally, that your voices are powerful, and it's even more powerful when we unite. So let's just come together and fight against these disparities. We can do it together, but we can only do it together.
Absolutely, and I think that's a great place for us to end. And Tenneisa, I want to thank you for coming and being with us on the show and sharing your work with us. And I hope you will continue to stay in touch with us at Total Health, because we're all fighting the same battle with our medical education. So thank you again for being in. Hang on after we're done. But for everybody else, Sharon will be back on Wednesday, and we'll see you all again. Thank you for tuning in. Thank you for your comments. And we'll see you next time on Tea Talks. Bye-bye.
Bye.